Okay, hi guys. I hope you're doing okay. So for this time, we will be discussing the concept of ectopic pregnancy. Now, what is ectopic pregnancy? An ectopic pregnancy results if implantation occurs anywhere other than in the uterine cavity. The most common site of ectopic pregnancy is the uterine tube. That is why ectopic pregnancy is otherwise termed as your extrauterine pregnancy. Implantation in the uterine tube eventually is fatal to the fetus and can cause the tube to rupture, considerably because the fallopian tube in itself is not the proper place for the growing fetus. It cannot accommodate a growing fetus. So in some cases, implantation occurs in the mesenteries of the abdominal cavity and the fetus can develop normally but must be delivered by cesarean section. Now, an ectopic pregnancy cannot proceed normally. The fertilized egg cannot survive and the growing tissue might destroy various maternal structures, primarily because, as what I have mentioned a while ago, your fallopian tube is not the conducive place or is not a proper place for a growing fetus to thrive. If this is left untreated, life-threatening blood loss is possible. That is why in most cases, your ectopic pregnancy calls for an emergency medical or surgical intervention. Early treatment of an ectopic pregnancy can help preserve the chance for future healthy pregnancies. Now for the next slide, I will show you how a normal pregnancy looks like and how an ectopic pregnancy looks like. So in normal pregnancy, if you can see here is the fallopian tube and the fetus or the embryo thrives or grows inside the uterus. Whereas in ectopic pregnancy, the embryo is stuck in this portion, if you can see, along the fallopian tube, in which if it starts to grow, even maski small size pa lang sila, it may cause the tube to rupture. So, here is an illustration of the different types of ectopic pregnancy. We have interstitial pregnancy. By the way, the type of ectopic pregnancy, the specific type of ectopic pregnancy refers, it is in reference to the location where the embryo or the egg grows. So when you say interstitial pregnancy, the development of the embryo is in the interstitial department of the fallopian tube. Isthmic pregnancy in the isthmus portion of the tube. And ampullary pregnancy wherein 70% of the cases of ectopic pregnancy usually occurs in the ampullary portion of your fallopian tube, together with fimbrial pregnancy, ovarian pregnancy, cervical pregnancy, and abdominal pregnancy. Now, how will you know if you have ectopic pregnancy or if you are experiencing ectopic pregnancy? Now, here are the signs and symptoms. So at first, an ectopic pregnancy might not cause any signs or symptoms. In other cases, early signs and symptoms of an ectopic pregnancy might be the same as those of any pregnancy. Example of which is the missed period, breast tenderness, and nausea. Okay. Another symptom is there will be light vaginal bleeding with abdominal or pelvic pain, which is often the first warning sign of an ectopic pregnancy. As I mentioned a while ago, ectopic pregnancy calls for an emergency medical or surgical intervention. Dili gid ni siya dapat padugay-dugayon. Otherwise, grabe na pain ang ma-feel ani sa patient or sa woman. If blood leaks from the fallopian tube, it is also possible to feel shoulder pain or an urge to have a bowel movement depending on where the blood pools or which nerves are irritated. If the fallopian tube ruptures, heavy bleeding inside the abdomen is likely followed by lightheadedness, fainting, and shock. Now, Considering that this calls for an emergency situation, when do you need to see a doctor? Okay, when are you going to see a doctor? You seek emergency medical help if you experience any signs or symptoms of an ectopic pregnancy, including the following. If you experience severe abdominal or pelvic pain, which is accompanied by vaginal bleeding. Another is when you feel or when you experience extreme lightheadedness or fainting, and when you feel excruciating shoulder pain. Okay? Now, what could be the causes of your ectopic pregnancy? Unsa may hinungdan nga nung magka-ectopic pregnancy man ka? Now, tubal pregnancy is the most common type of ectopic pregnancy. This actually happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by inflammation or if the fallopian tube is misshapen. Another cause that is brought about by this occurrence is the hormonal imbalances or abnormal development of the fertilized egg. They may play a role in ectopic pregnancy. Now, here is an illustration of what happens when an embryo develops in the tube or within the tube. Mao ni siya ang mahitabo. Fallopian tube, this is what it looks like when a fallopian tube contains a large ectopic pregnancy. Now, as the pregnancy grows bigger, this part here will rupture or it will burst. Okay. Then here, this contains a small ectopic pregnancy. Although very small lang siya, pero ang babae ana, ang buntis na babae ana is very sensitive to pain. Because kanimanggod siya na muscle diri is not elastic or is not parang flexible. Yun siya. So, maski gamay na foreign body in which kani siya, this growing fetus, the growing embryo in this portion, dili na siya dapat din mag-thrive. Otherwise, kung magdako na siya, mag-anam-anam na siya o kadako din hinga portion, the tube will eventually burst or rupture. Okay? So, who are at risk for ectopic pregnancy? Now, according to studies, up to an estimated 20 in every 1,000 pregnancies are ectopic. Various factors are associated with ectopic pregnancy, including the following. Previous ectopic pregnancy. If you had a history of an ectopic pregnancy, there is a bigger chance for you to have another episode in the future pregnancy nimo. Another risk factor is the inflammation or infection. Inflammation of the fallopian tube, otherwise termed as your salpingitis, or an infection of the uterus, fallopian tubes, or ovaries, which compose your pelvic inflammatory disease, they increase the risk of ectopic pregnancy. Oftentimes, kani siya ng mga infections, your salpingitis, your PIDs, are caused by gonorrhea or chlamydia. If for your information, when you say gonorrhea or chlamydia, these are causative agents for some of your sexually transmitted infections. Fertility issues. Some research suggests an association between difficulties with fertility as well as use of fertility drugs and ectopic pregnancy. Another issue which highly contributes to ectopic pregnancy are the structural concerns. An ectopic pregnancy is more likely to happen if you have an unusually shaped fallopian tube or if the fallopian tube has been damaged, possibly during surgery. Kung naay something na murag gas-gas along sa fallopian tube, say for example, eroded ang portion atong fallopian tube, posible na ang embryo will be trapped in that portion nga na-erode. So, dito siya mag-standby, dito siya ma-stuck, dito po siya eventually mag-grow, leading to ectopic pregnancy. Here, even surgery to reconstruct the fallopian tube can increase the risk of ectopic pregnancy.